Hello and welcome to the Claiborne Memorial Medical Center 2020 Open Enrollment. My name is Jason Wineland. I'm with J. Wineland Group Benefits and we are the agents for the Life and Health Employee Benefit Plans. I'm going to briefly relay the important information regarding any changes to benefits and cost for your core benefits for the 2021 plan year. The plan year runs from July 1 each year to June 30. First and foremost, the hospital administration team worked hard this year to ensure that it can continue to provide great benefits at an affordable cost, and we are pleased to announce that there are no changes to the core benefits and no increase to your payroll deductions for the upcoming enrollment. The month of June is the open enrollment for the medical, dental, vision, voluntary life, and disability plans. Any changes you make will be effective July 1. At this time, you are allowed to change who you are covering or enroll in the benefits in which you are currently not participating. Of course, there are rules regarding the changes you might want to make, and we will discuss those rules briefly here. Be advised that representatives from our firm will be on site Tuesday, June 2nd from 7 a.m. to noon and Thursday, June 4th from just before lunch throughout the afternoon. We'll be located in the small conference room behind the receptionist. Please make time to come see us if you have any questions regarding your benefits, cost, or any claim issues we can help you with. So let's get started with a high-level overview. The medical plan is administered by Blue Cross Blue Shield of Louisiana. It has a low annual deductible of $750. After you've met your deductible, Blue Cross pays 80% of the benefits, you pay 20%. When your 20% plus your copays equals an annual out-of-pocket of $4,000, Blue Cross pays 100% of all charges. You have good low copays of $30 and $45 for a primary office visit and specialist respectively. Urgent care copay. You also have copays for prescription drugs. No changes here. $15 for generic, $40 for a preferred brand, $70 for non-preferred. If you're on a specialty drug, it will continue to be 10% of that cost of that drug with a maximum of $150. There may be changes to your formulary prescription this year. Please go to bcbsla.com and pull up the formulary to make sure your drugs stay in the same tier class. The dental benefits are administered by Insurance Management Services. You have a low annual deductible of $50 per person. After you've met your deductible, preventive services, like your annual routine exam, is paid at 100% with no cost sharing. Basic services, like a filling, are paid at 80%. Major services, like a crown, are paid at 50%. When the plan has paid $1,500 over the course of a calendar year, the benefit is exhausted. The plan also has orthodontia benefits, but these benefits are limited to dependent children under the age of 21. It's a 50% coinsurance with a $1,500 lifetime benefit. The vision benefits are also administered by Blue Cross Blue Shield. This benefit uses Davis Vision Network providers. It's critical that you use a Davis Vision provider to maximize this benefit. You see there is $0 copay for an exam. You can get frames for $15 with a $150 allowance. When you get your lenses, also a $15 copay. Contact lenses are available only once every 12 months, and you get up to a $130 allowance. Keep in mind that the plan allows for either glasses or contacts, but you can't get both in the same plan year. As you can see, the payroll deductions for the upcoming plan year, July 1 to June 30th of 2021, have not changed on the medical and dental plan. The vision rates, however, went up just slightly. As a full-time employee of the hospital, you are provided with $25,000 of group life insurance benefit and an additional $25,000 of what's called accidental death and dismemberment insurance. If you pass, your beneficiary received $25,000. If you pass due to an accident, it's a double indemnity benefit and you get an additional $25,000. This is at no cost to you. You may purchase additional life insurance at your own cost. You can purchase 5 times your annual salary with a guarantee issue, which means you do not have to answer medical questions, up to $130,000. You can buy the same amount for your spouse, but the guarantee issue there is only $30,000. You can buy insurance for your children in the amount of $10,000. Be advised, if you're currently on the plan, you can purchase an additional $10,000 every year and you do not have to answer medical questions. You cannot do that for your spouse. Any additional coverage there, you must answer medical questions. If you are not currently enrolled in voluntary life insurance, you must answer medical questions upon enrollment. The hospital also offers, at your own cost, voluntary short-term disability. This is paycheck insurance. In the event that you are injured or ill, this benefit will begin paying 2 weeks after that and proceed for 11 weeks, so 90 days total. The benefit amount, 60% of your gross weekly earnings with a weekly maximum of $1,000 per week. We strongly advise that you look at this benefit. There are no medical questions during the open enrollment. 30% of the workforce in America has some point in their lives has a short-term disability. Please consider this. In addition to short-term disability, you may want to consider purchasing long-term disability. These benefits begin as your short-term disability benefits are exhausted. Mutual of Omaha offers 2 options. The less expensive option pays 50% of your gross monthly earnings with a benefit maximum of $5,000 per month. The benefit duration is limited to 2 years. The more robust option pays 60% of your gross monthly income with a benefit maximum of $7,500 per month. But this benefit duration takes you to age 65 or when your Social Security retirement age, whichever is longest. All employees are required to turn in the internal payroll deduction sheet. This form was included in the email blast from the hospital administration last week. If you do not have this form or need assistance in completing it, please make time to visit with the representatives from J. Wineland Group Benefits. In addition, we will have all the forms and documents for your review and completion. Again, we'll be located in the small conference room just behind the receptionist and be on site Tuesday, June 2nd from 7 a.m. to noon, Thursday, June 4th from just before lunch through that afternoon. If you miss us and have questions, you can call me, Jason Wineland, 318-230-7132, or Miss Raymond Norton at 318-230-7132. And last but not least, all your forms are due Monday, June 15th at noon. Turn them into the administration office. Thank you. Have a nice day. We'll see you soon.